Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Yang terhormat Profesor Dr. Anda Yayi Surya Prabandari MSI PhD selaku Ketua Departemen Perilaku Kesehatan, Lingkungan dan Kedokteran Sosial. Yang terhormat Profesor Juliet dari Institute for Sustainable Futures, University of Technology, Sydney. Yang terhormat Dr. Daniel dari Departemen Perilaku Kesehatan, Lingkungan dan Kedokteran Sosial FKKM KUGM. Yang terhormat Dr. Vika Oktariani, MPH PhD dari Departemen Biostatistik, Epidemiologi dan Kesehatan Populasi FKKM KUGM, serta Bapak Ibu dosen dan hadirin sekalian. Puji syukur kehadirat Tuhan Yang Maha Esa, karena atas karunia-Nya kita berkesempatan kembali untuk berkumpul dalam acara seminar Rabuan pada pagi ini, pada tanggal 5 Juni 2024 dengan tema Water and Sanitation Strategies to Maintain Public Health. Dan perkenalkan saya Zilvani yang akan memandu acara pada seminar Rabuan pagi kali ini hingga nanti acara selesai. Dan agar acara berjalan dengan baik, Bapak Ibu izinkan saya untuk terlebih dahulu membacakan beberapa peraturan dalam acara seminar Rabuan pada pagi hari ini. Yang pertama karena acara berlangsung secara hybrid, jadi untuk Bapak Ibu yang hadir secara daring dimohon untuk mematikan sementara fitur audionya, dan bagi Bapak Ibu yang hadir di ruangan dimohon untuk tenang nantinya selama berjalannya acara. Dan bagi Bapak Ibu yang hadir secara daring nantinya dapat mengajukan pertanyaan secara langsung melalui kolom chat tanpa nantinya menunggu selesainya penyampaian materi. Namun bagi Bapak Ibu yang hadir di ruangan nantinya dapat diberikan kesempatan untuk menyampaikan secara langsung pertanyaannya saat sesi tanya jawab. Dan Bapak Ibu yang hadir secara daring dimohon untuk nantinya mengisi presensi, link akan kami bagikan nanti di kolom chat, dan nanti link materi juga akan kami bagikan di kolom chat. Baik, sebelumnya izinkan saya untuk menyampaikan susunan acara pada pagi hari ini. Yang pertama nanti akan dibuka dengan sambutan dari Ketua Departemen Perilaku Kesehatan, Lingkungan dan Kedokteran Sosial, kemudian dilanjutkan dengan penyampaian materi oleh ketiga materi. Untuk materi yang pertama nanti akan disampaikan oleh Dr. Daniel, kemudian dilanjutkan oleh Profesor Juliet, dan dilanjutkan dengan Dr. Vika. Kemudian akan disambung dengan sesi diskusi dan nantinya akan diakhiri dengan penutup. Baik, dan untuk acara yang pertama mari kita simak bersama sambutan dari Ketua Departemen Perilaku Kesehatan, Lingkungan dan Kedokteran Sosial kepada Profesor Dr. Anda Yayi Surya Prabandari. Dipersilahkan.
Terima kasih Mbak Silvani. So, Bapak Ibu semua, so dear participants, thank you for joining our Wednesday seminar today, which the title is Water and Sanitation Strategies to Maintain Public Health. On behalf of the Department of Health Behavior, Environment and Social Medicine, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, I would like to thank for all the presenters today, especially Prof. Juliet Willets from the Institute for Sustainable Futures, University of Technology, Sydney, Australia. Thank you for later giving us insight about the water and sanitation strategies to maintain the public health of Indonesia, and maybe you will share what already or have been done in other places. So thank you very much, Prof. Juliet. And then I would like also thanks to Dr. Daniel. This is our staff in the Department of Health Behavior, Environmental and Social Medicine, Faculty of Medicine, Public Health and Nursing. Thank you for your contribution to learn, to share about the water and sanitation strategies in Indonesia. And also for Dr. Vika Oktaria, MPH PhD, who is the chair of the Department of Biostatistic, Epidemiology and Population Health, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. And then the moderator, also I would like to thank you for Dr. Anissa Utami Rauf. She is also the member, the staff member of Department of Health Behavior, Environmental and Social Medicine, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. And especially for all the participants who already joining our Wednesday seminar, thank you for your participation. And then for the committee for preparing this very important and insightful seminar today, as well as Mbak Silvani for being a master ceremony for today. So all enjoy and enjoy the seminar, and I hope that all of you can have more information and more insightful about the water and sanitation strategies in to maintaining the public health in anywhere, especially in anywhere in Indonesia, and if you also want to working outside of Indonesia. Thank you very much. So I return back to Mbak Silvani. Wassalamualaikum warahmatullahi wabarakatuh. Salam sehat.
Oke, terima kasih atas sambutannya Prof. Yai. Baik Bapak Ibu, sebelum memasuki acara inti, mungkin kita terlebih dahulu foto bersama. Karena diadakan secara hybrid, mungkin bisa dimulai dari yang ada di room Zoom terlebih dahulu ya. Kita dahulukan yang di room Zoom dulu mungkin. Bapak Ibu yang ada di Zoom bisa menyalakan terlebih dahulu untuk kameranya. Pak Anton mungkin ya yang ada di ruangan bisa dibantu untuk mengambil gambarnya. Oke, sudah? Oke, baik. Terima kasih. Bisa dilanjutkan. Untuk yang ada di ruangan mungkin bisa dibantu Pak Heri. Mungkin bisa diambil dari depan seperti itu. Oh ya, mungkin yang ada di pinggir bisa merapat ke tengah, monggo. Oke, baik. Terima kasih, Dimo. Baik, langsung saja Bapak Ibu hadirin sekalian. Kita langsung saja untuk memasuki acara inti dari seminar Labuan Pagi kali ini. Dan kali ini kita akan dipandu langsung oleh moderator dan telah hadir bersama kita Ibu Dr. Anissa Utami Rauf. Monggo Bu Anissa bisa mengambil posisi. Oke, namun sebelumnya mungkin kita perkenalan terlebih dahulu dengan Bu Anissa mungkin secara singkat. Bisa ditampilkan untuk CV-nya. Oke, baik. Ya, Bu Anissa ini merupakan salah satu dosen di Departemen Perilaku Kesehatan, Lingkungan, dan Kedokteran Sosial. Beliau mendalami ilmu kesehatan masyarakat tentunya, utamanya di bidang kesehatan lingkungan, seperti polusi udara, kemudian ada kualitas air, penilaian risiko kesehatan, dan pemodelan lingkungan. Baik, kepada Bu Anissa, waktu dan tempat kami persilahkan.
Yeah, thank you Mbak Zilfa, and also thank you Prof. Yai for opening this seminar for today. And yeah, good morning everyone. Good morning everyone. Assalamualaikum warahmatullahi wabarakatuh. It's such an honor for me to be the moderator today. As mentioned, my name is Anissa Utami. You can call me Anissa, and it's a beautiful day today, and we have an interesting topic about the water hygiene and sanitations. And yeah, we will ask all of the speakers to join me here next to me, and please have a seat, all of them. So we will continue the sessions. Yeah, bebas dimanapun. Yeah. So today we discuss about water and sanitation strategies to maintain the public health. As we know that water is essential thing in our life. The change of the compositions of the water and also the availability will influence our health and also our well-being. And today we are fortunate to have three distinguished speakers. Let's say hi to them. Selamat pagi, Dr. Vika, Pak Daniel, and also Prof. Juliet. Thank you for joining us today. And our speaker will share their insight, perspective, and also maybe recent project or maybe the recent publication related to today's topic. And this promises to be the highly informative section. So everyone, if you have any questions, any concern or comments, you can just give your question through the chat box. If you're joining us through the Zoom meeting, and if you are joining us in person today in this room, you just can raise your hand. But the question and answer will be in the last after all the speakers finish their presentations. So before we go to the first speakers, Dr. Daniel, I will read his CV, short profile. We know him, but yeah, let's. Dr. Daniel is graduated from Institut Teknologi Bandung and continue his master and doctoral degree in IHE Delft and Delft Institute of Technology in the Netherlands. And Dr. Daniel is now active research in and also lecturer in Department of Health, Behavior, Environment, and Social Medicine here in Universitas Gadjah Mada. Dr. Daniel also have several publications related to water and also hygiene and sanitations in Indonesia. For everyone who wants to know more about him, you can just try to find his name in Google Scholar. He has so many publications related to today's topic. And yeah, for the first speaker, Dr. Daniel will deliver the presentations. For all speakers will have about 10 until 15 minutes for presentations. And if you have any questions, if you have any questions, it will be just send it or just wait until all of the speaker finish the presentations. Baik, untuk Pak Daniel, so I'll hand over to you. Please, you can start your presentation.
Test. Okay, so we'll have about 20 minutes presentations, not 10 minutes.
Oh, okay.
we are preparing the slide for 20 minutes.
Okay,
but
nice.
It's okay. Let's see. Thank you, Bu Anissa. Thank you, everyone who joined this meeting. So today for the first sessions, I'm gonna share a bit about the situation in Indonesia, how safe is our drinking water. I have told you many things in the lecture, but there are some findings from my research and also from my students, and I want to share here today with you. So next, I have so I hope you can see the picture. It's not really clear from here, but so this is the situation. So I took this picture from our Word in Data, I think, from the Google, from the website, and we can see the number of death of the people related to diarrhea. So if you see the left, how can I say this, the map, so our contributions to the death due to unsafe drinking water is 3.2%. So that's quite high, and you can see the situations. Yeah, we are relatively better if we compare to the Africa continents. In India, you can see a big picture there, but the number is still high, and we can see also the progress of number of people dying. I cannot really see it, but yeah, the number is decreasing. That's a good thing that we know, but still high. If we compare the results to 2009, and we can see the decreasing from 44% to 30 something. yeah, I cannot really see it, but yeah, the situation is better. We are improving a lot, but still, I mean, if we talk about people dying because of unsafe water, we are trying to prevent this using better water and sanitation services. Okay, next slide. Yeah. Okay. I know. Yeah, maybe you are familiar with this definition. So we have the Sustainable Development Goal, and SDG 6.1 talks about water, and the joint monitoring programs, they make a kind of characterizations, kind of level. So the highest level that we want to achieve is we want to have safely managed drinking water services. But it seems difficult. Okay, if we see the progress in Indonesia, you see my bullet points there. The national target is 15% in 2024, but the situation in 2020 is about 12%. We don't know the situations now because the national government, they are doing how do you call it, drinking water surveillance, and they are still collecting the data, analyze the data. But let's see, it's maybe we can achieve in 15% in 2024, but we are still waiting for the results. But they are still long run to achieve this target. And also, yeah, the situation in Indonesia is, if you talk about the second layer is the basic services, is relatively good, 93% in 2020, and we are still, yeah, the national government is doing a lot of things to improve the situations. And why this target is very difficult and very complicated in our case, because if you see the definition of the safely managed, it's written there that the water must be available when needed. So, but the problems, I don't know, in your place, if you are connected to PDAM, for example, I don't know whether your water is flowing for 24 hours, but yeah, so we have a lot of problems. We have a lot of complicated things in our systems. And another thing is also, yeah, we talk about the constant pressure in the pipe systems, and also water source type, etc. And all of these influence the contamination in the drinking water. So basically, as I mentioned before, that we have 93% of the basic services. That's high, but why the number is very low? When we talk about the safely managed, going down to almost 12%, that's because the safety is a problem. So we have problems with the safety. Actually, when we talk about the access, that's relatively good, 93%, but the safety is a big question that we have to answer. And another thing, also, yeah, I don't know, maybe Professor Juliet can, but this kind of definition may apply for developed country, but in our case it's a bit difficult, because let's say we have problems with safety in the water source, and the definition of safely managed is not you have a good water quality in your home, in the water that you want to drink, like this glass, but in your water source. And that's a big problem, because yeah, it's difficult to maintain the water quality in water in the tap. For example, in developed country, when you open the tap, you can drink directly from there because they maintain all the quality. But in our case, yeah, I don't think we can drink from our tap. So it's relatively difficult to really achieve the safely managed water system. That's why I would say in the context of developing countries, it may be not realistic. It's impossible to really achieve this level. Okay, and this is the results. So the national governments conducted a national drinking water test in 2020, and this is some of the results. And you can see, for example, not all. Okay, so POU is point of use. Oh, sorry, it is okay. So the middle column is point of collections. It means that the water source, tap water, borehole, spring, rainwater, etc. And the point of use is the water that you drink in your house. So taken from the water storage. And you can see here that, yeah, not all houses they have clean water source, because for example, if you see the TDS, the TDS only 93%, and even in the house also the TDS is also, not all houses they have meet the standard in terms of TDS, and you can see some of the important parameters that are measured by the Ministry of Health. For example, the E. coli, the total coliforms, so and pH, etc. So we have a big problems about the water quality, and the national government's trying to improve the policy. So last year they developed this new Permenkes, the Ministry of Health policy, and they're trying to include even more chemicals in the regulations, include more chemical emerging contaminants in the regulations, which makes I think it's more difficult really to achieve the safe drinking water. Okay, this is the map that are produced by one of my students. And you can see here, if we see the conditions, this is point of access, so the water source, and you can see here that the map, you can see the situations in Java. For example, the number is relatively red compared to other areas, so it means that the water source in Java is maybe more contaminated than other area. And one interesting thing here, if you can see the map in Papua, I think it's 50%. So based on the sample, and the quality in Papua is relatively better compared to other areas. Even though we have some questions whether it's correct or not, whether they do it correctly or not, something like that. But yeah, this is the situations right now. And next slide. Yeah. So this is work of my students, and so we are trying to quantify. So we know the E. coli situations in the household level, and we are trying to estimate the burden of disease, because this is what we want to know. Before, usually people, they just quantify, they just make a classifications. For example, if you have no E. coli in your drinking water, and you say that, okay, the risk is low. If the number of E. coli is from 1 to 10, the risk is medium, etc. But now we are trying to quantify the number of diarrhea, the estimation diarrhea, the burden of disease of the people, using the method called quantitative microbial risk analysis. So basically we have the E. coli informations. Using some mathematical equations we calculate, and we have the informations about the burden of disease. But again, this is a problem in our country, that the data that we receive is not really, it's just an estimations, so not really the exact number of the E. coli. So we have these big limitations to really calculate the burden of disease. Okay, and from there, from the E. coli, using some proxies, we can try to estimate the number of the amount of other pathogens. So, for example, we using the number of E. coli, we can estimate the pathogenic E. coli, and also other pathogens, rotavirus, etc. And from here, you can see, when we calculated the burden of disease in point of access or in water source, is 0.177 DALI per person per year. So the standard of WHO is 10 to the power of -6 DALI per year per person. But now we really the number is very high, so basically we don't meet this requirement. And also, if you see the point of use, or it means that the water that you drink is the DALI is also almost half of the water source. And another thing, when we calculate the contributions of the water source, so some is sumber air minum, so point of collections. And you can see that air isi ulang, so we will talk about this later. So air isi ulang, refill water from Damyu, from the water kiosk, is really high. So we will see the reasons after this. But yeah, and also from there you can see the interpretations. I put it in the box. In 1 year, a person is estimated to lose 65 days of healthy quality of life because of diarrhea, because of consuming water, this kind of water source. So it means basically that we need to improve our water. We have to do any kind of treatment, but the question is whether it is enough or not. We will see the results after this. Okay, and this is the estimations of burden of disease if we make them in a map like this. And you can see again, Java, they have they contribute a lot. The number of DALI is very high in Java. The main reason is when you calculate the DALI, the burden of disease using QMRA, the most important parameter is the number of populations, and we know that Java is very populated, so that's why that's one of the reason why the number of burden of disease is very high. Okay, next slide. Yeah, and also from the QMRA, we can estimate the number of diarrhea in the populations, and from the calculation we estimated. This is only based on pathogenic E. coli, and we see that the number of diarrhea, the estimated diarrhea is 62 million due to point of access or water source, and in house, in point of use is 39 million cases. So if we compare these results with the national survey, the prevalence of diarrhea in Indonesia is almost 10%, so or 26 million cases. So basically, based on our estimations, the number of diarrhea should be higher than this number. But yeah, we know that maybe people, they don't report to the Puskesmas, so the number is not really represent the real situations. But you can see that drinking water, unsafe drinking water, really responsible for all this kind of diarrhea. Okay, and in Indonesia, with not all the populations, they have access to PDAM, to the tap water. So many people, in my place also, we have a bore, we have a bore well, we have a self-supply. Many of them, we have a self-supply water source. And you can see here that, okay, so from the national survey, it's estimated that 37 of the Indonesian populations we self-supply, but the worst thing is 70% of the self-supply is contaminated with E. coli. So people trying to get more accessible water, but now we have problems with the E. coli, with the pathogens. And okay, and we see also that the self-supply has a higher chance of being contaminated compared to the tap system or PDAM system. Yeah, it makes sense because usually the self-supply, people, they don't do any treatments, but in PDAM they do any kind of treatments there. And okay, yeah, next. Okay, and then the question is how to have safe drinking water at home. So the simple answer is we can treat the water at your home, but then we did another study. I think this is 2 years ago. We did a study in Nusa Tenggara Timur, and we found that even though people treat their drinking water, the water is still not safe. So you can see here, for example, the treated water is almost 76%, something like that, but you can see only 40% of the treated water is safe. So treating water doesn't mean that you can completely, if you do it correctly, it can completely remove all of the pathogens, but there are many factors we will see after this that are also contributing to the water quality in your house. Okay, and from the national data, we try to do simple regressions, and again, there are many factors that we include in the regressions, and we control also the locations to see the effect of all of this to the water quality. And there are five factors or 5 variables that are significantly related to the water quality in your home. And the first one is the quality of the POC or the quality of the water source. So it means that if you have better water quality in your water source, in your tap, springs, borehole, etc., it means that you are more likely to have better water quality in your storage, in the water that you drink. And also, if you do household water treatments, it improves the water quality. It is related to the better water quality. And if the storage is not placed in a place that is easily contaminated, and the storage is covered, there's no sign of contamination, all these factors positively contributed to the water quality. But the highest factors, the most important factors that has the highest influence is the quality of the water source. So it means that even though we do any kind of treatments, but we have a responsibility to improve the water quality in our water source. Okay, and this is another study that I did in my PhD. We are trying also to estimate factors related to the water quality in the storage, and we are using a mathematical modelings. There are many factors there we put there. Again, we found the water quality in the water source is really influential to influence to affect the water quality in the in the drinking water. So yeah, we need to improve the water quality, and also this is another findings that we found, because in statistic it's a bit difficult to really see the combinations, the effect of the combinations of factors, but using these methods we can see the effect of the combinations, and we found that household water treatments can improve the water quality, but the effect is better if you have more hygienic situations. So it means that basically, we need to improve all things. So in simple word, we need to do a multi-barrier preventions, not just treating the water, but improve everything. So we have to check the water storage conditions. We have to check whether it is placed in the hygienic place or not, something like that. So we need to improve the whole hygiene conditions in our house. Okay, and this is I have to talk about this, the packaged drinking water. So this is the gallon water. I think most of us or all of us may be using this kind of water, and we will see how is the quality of the packaged drinking water. Okay, there are many terms, but I often use packaged drinking water. So packaged drinking water here is a cover refill water. So water that you take from the dummy, from water kiosk, and also unrefilled water. So sealed water. So like aqua, le mineral, etc. So we in one of our study with my students, and we try to estimate the trend of the packaged drinking water, and it is indeed the number is increased, and we expect that 50% of the Indonesian populations in 2026 will use this kind of drinking water. So, but now the question is, how is the safety of this drinking water? Because people, if we see other literatures, they prefer to have this kind of water because, okay, it may be clean. They think that the water is clean, so it's safe, something like that. But we will see the results. Okay, this is the results from Yogyakarta in 2016. I think they did the study, and you can see the bar that I highlight there. The household drinking water from vendors, it means that the packaged drinking water, whether from water kiosk, Damiu, or from unrefilled drinking water, and 50% of the samples are contaminated. So this is the situation in Jogja, and there's another study from Bandung, and also they found more or less the same things, but you can see when they compare the refill bottled water, so the water from the water kiosk from Damiu, is relatively worse compared to bottled water. So I know it's cheaper, but the quality is worse compared to bottled water, the unrefilled water. And also this is the data from the SCAM RT, from the national survey. They also found that 50% of the unrefilled and bottled water are fecally contaminated. So it means that all these kind of brands, they are not really safe. But we must be careful, because maybe they did correctly all the treatments, but maybe the situations in the water storage in the house is not clean. It may influence the water quality. And again, the refill water are worse compared to unrefilled drinking water. So in short, packaged drinking water is not always safe. Okay, and we have problems also about the microplastic. I think 2 days ago I just read a news that they found this is a new study that they found that Indonesia is the country that consume the highest microplastic in the world. This is just a published study, I think last month or several weeks ago. So we have problems with microplastic. This is another, even though we still, the expert, there are still many arguments about the effect of this on our health, but we must be careful about this. Okay, I go back to the Damiu water kiosk. It's cheaper, but let's see the results. Okay, this is another master thesis study that are doing now by one of my students, and she collected a water sample from 106 dummy water kiosks in Palembang, and it is indeed the water quality, the treatment that they are doing in the water kiosk improve the water quality. So usually the dummy they use filter, UV treatments, etc. It improves the water quality, but you can see here from the results that, yeah, it improves the water quality from the average of 82 CFU per 100 milliliters to 18. So it means that even though the water is already treated, they still found the E. coli in the drinking water. And the number is 18. So this is, the risk is medium, not medium, high. Because high is from 100 to from 10 to 100 E. coli, and E. coli is detected in 42 samples, and the burden of disease, you can see here the burden of disease, but the average is 1.1 times 10 to the power of -2. So it means that people usually lost 1 to 5 days per year due to diarrhea. And another thing, okay, the majority risk of dummy is medium risk. So when the students conducted observe the situations, and most of the dummy they are not really clean, let's say something like that. And the other thing, so my students trying to estimate, trying to make a map, visualize all the findings in the map, and you can see here also from the map that, yeah, the red, the pie charts in each sub-district or kecamatan, and most of them are in red and yellow. So yeah, it's not really hygienic, the situations in the dummy. And we also, this is a good thing that we found from the study. We found strong correlations between the estimated cases of diarrhea. So we estimated using the QMRA in toddler and the actual reported diarrhea at the sub-district level. So yeah, what I want to say is we can use the QMRA to estimate, maybe to have a better estimations about the number of diarrhea in one locations using this method. Okay, this is my final slide. Okay, again, our drinking water is not fully safe, and we have to do multi-barrier preventions. We have to improve the water quality using household water treatments, but again, we have to make sure that the situation surrounding the water storage is safe, is hygiene. And also the packaged drinking water is not always safe, especially for refill water from dummy. So this is a big task for us from the public health measure. How can we teach people? How can we also make sure that the dummy, they can really perform all the treatment well, and etc. to make sure, because many people, if we compare the refill water and unrefill, most of the people, they prefer to use this kind of water, but again, the quality is not safe. So we have to make sure we have to do any kind interventions to really improve the situations. I think that's all from me. Thank you. I return back to Bu Anissa.
Thank you so much, Dr. Daniel, for the presentations. It's really interesting. Yeah, Dr. Daniel previously mentioned that we need more integrated prevention. So not only if we see the water is clean, so it means it's safe, but yeah, so with several treatments, we could find that several factors is also influencing the quality of the water that we consume, especially from the storage, from the source, and also yeah, hygienic behavior, since we have some how do you like misalnya kalau kita di rumah kan kita sudah merasa airnya aman. Nah, ternyata apalagi tadi sudah ada tambahan about microplastic things, so it's not safe, even though maybe some of the advertisements say that it's ada manis-manisnya, and also it's clean, it's healthy for us. So just be careful for all of you, especially for kosan people, yeah. So yeah. So thank you, Dr. Daniel, for the presentation. So we will move to the next speaker. So our second speaker, Professor Juliet Wiltz from University of Technology Sydney Institute for Sustainable Future, and Professor Julia will talk about public health risks of on-site sanitations. So Professor Julia finished a bachelor degree in University of Sydney and the doctoral degree in the University of New South Wales, Australia. And now Professor Julia is the position of is a professor in research director at University of Technology Sydney, as I mentioned, and she has so many also publications and also some research in Indonesia. So one of them is evaluations of participatory citizen approach to monitor microbial water quality of supply in urban Indonesia. It's conduct in Indonesia, I guess. So without any further ado, I will hand over to Professor Juliet. Professor Juliet, it's time for presentation for you.
Okay, thank you very much, and thank you for the invitation to speak this morning. Thank you to Daniel and others, Ibu Yayi, for the welcome and for organizing. So my background is engineering, so I'm going to be speaking about public health aspects, but I'm not really qualified, yeah? You're all learning about public health, but I'm very passionate about the intersection between different areas, and it's only with collaboration across areas that we can address the health problems related to water and sanitation. Do I need to do something? Just that one? Okay, so Danny has mentioned quite a lot about some of the problems with our drinking water, and one of the sources of the fecal contamination of drinking water is from on-site systems. And so I have a few questions for you to start with. Can anyone tell me what proportion of people in Indonesia do you think use on-site sanitation systems? So a chubluk or a septic tank? Anyone like to give a guess? How many percent? A guess? How many percent? 20, 40, 90, 50? Danny said 90. Okay, you're not allowed to answer the next question because that is correct, but he's letting you all off the hook. So it's about 80%. So the majority of the Indonesian population is using on-site sanitation systems. So then the next one is, of these systems, how many of them are contained? And contained means that we keep the fecal matter away from people, away from going into the environment. If they're uncontained, it means the fecal matter can spread into the environment. So we have 80% of people have on-site sanitation. What proportion of these do you think maybe might be uncontained, might be allowing pathogens to go into the environment? Any guesses? You're not allowed to answer any more, Danny. Only the audience, only the students. What proportion do you think might be uncontained and allowing pathogens to go into the environment? We just heard about many of the drinking water problems, so it must be some proportion. Any guess? No? Okay, so it's about 50%. It's about 50%, and that is systems which are so these systems are under the ground, and uncontained means either there is no lining, and so the water is filtering down into the soil and it's coming out, or it might mean that the system is sealed, but the overflow is going into a drain or somewhere else, or it might mean that the system's never been emptied. And so all of these mean that fecal matter is getting into the environment. And the last one is the septic tank. So many of you, I'm sure, have a septic tank at your home. When do you think this technology was invented? How long ago? Like a very long time ago, 1800 or 1950? How long ago do you think that was? It's been a long time. Yeah, we've had this technology for a long time. So it's been since 1860. It was actually a French guy, Marcel Proust, and he got sick of going outdoors in the snow to use the toilet, and he's the one that invented the septic tank and the idea to try and seal and treat the waste right at the house. So we're going to be talking some more about these on-site sanitation systems and how they create public health risks. And I will speak in 3 parts. The first part is about how the fecal matter can get into drains and into surface water. And that is one of the pathways that we can have an impact on public health. The second is about groundwater, when we have an on-site sanitation system and the water from it is going down through the soil and ending up in the groundwater. And the third part is what are some different strategies, what can we do to reduce the public health risks. So the first part, looking at on-site systems and how the fecal matter may get into drains and surface water. First of all, this photo. What might be going wrong in this picture? What's the issue? So we have some children sitting, playing, eating. They're very, very close to some very, very dirty drain water. If you look very closely, when I was there in real life, there is actually fecal matter floating in the drains here. And that you can see an outlet pipe here. It's coming straight from the toilet. It's not even going to a septic tank or anything. It's just coming straight to the drains. So this is a bad situation, yes, but definitely these children are exposed to the waste that's coming from the toilet and sometimes also coming from the on-site systems. And this is now a way of mapping the fecal waste at a city level. I won't go into the details, but the red means that uncontained fecal matter is getting into the environment. This is a map for Dhaka in Bangladesh, but many cities in Indonesia would also have a lot of red color if we made a similar map. And we have waste that gets dumped, so it might be collected from a septic tank, but then the tanker might drop it into a river. We have uncontained on-site sanitation systems, which is what I will be talking mostly about today. And then we also have sewerage systems which don't necessarily work. The waste doesn't necessarily get all the way to the treatment system, or the treatment system may not be functioning well. And in Dhaka, unfortunately, we have all of those problems, and it means that we have a lot of fecal matter which ends up in the living environment. And if we look now just at on-site systems, at septic tanks or chubluks, a study from 39 cities around mostly low and middle income countries, we can see that the effluent, so the liquid that comes from these treatment systems, 50% of it is going directly to a drain. And they were not designed to be used in this way. So when the French person many years back in 1860 invented the septic tank, the idea was that you have a tank, you have 2 tanks actually, and then you have a soak pit, and then you have treatment in the soil. And in the soil actually it's a very, very important step to remove the pathogens. The containment system that we first put it into doesn't remove a huge amount of pathogens. It's the soil that is very important for the treatment. And so the fact that we're then using this technology and we're having only the containment system, and then we take the liquid and we put it to a drain and into a human environment is not a good thing. It's not what it was designed to do, but in many, many countries, a large proportion of the systems are implemented in this way. And so we did a study in an informal settlement in Dhaka. It's actually a very organized informal settlement, so very, very low income houses with many, many people. It's all set up in these parallel streets with compounds with maybe 20 houses, all living very, very close to one another. And what we wanted to look at was the septic tanks and the toilets that were going with the waste going straight to the drains. And what we looked at was to look at the health risks that were associated with exposure to the pathogens that were in the drains. So in the photo I showed earlier with the children, we want to understand what is the health risk for these children from playing in and living in an environment where the fecal matter is going into the drains. And what we did was measure pathogens in many, many samples from the drains. And so Danny was talking a lot about E. coli. So E. coli is an indicator bacteria. It helps tell us if there are some pathogens present, but it doesn't always tell us accurately which pathogens are there and in what concentration. It's just an indicator. So in this research, we used qPCR, which is a method to actually analyze which pathogens are in the water. And we looked at some specific bacteria. So we looked at Shigella and we looked at Vibrio cholerae. And we also looked at Giardia, we looked at Typhi, and we looked at final one. And what we found was that in many, many of the samples, we found presence of most of these pathogens. So this is just presence absence, but we also measured concentrations. And what we did was having some empirical data to understand the actual concentrations. We set up a model which had two parts. The first part was to understand and predict what the concentration of pathogens would be in the drains. And we needed to know how much grey water a house is using, how much water is used in the toilet, and we can predict the concentration in the drain, and then we check that with our own measurements. And then the second part of the model is a little bit similar. It uses also the same method that Danny mentioned of quantitative microbial risk assessment. And for each of those pathogens I showed earlier, we looked at dose response curves, which is what tells you whether you're likely to get sick, whether you're likely to get infected. And from this, we can then predict the burden of disease. And from these modeling, we were able to look at our modeled numbers and what we observed from our samples. And we found that our samples mostly fit within what our model was predicting. And so then we used our model to say, okay, what if we improved the sanitation system, and how much reduction of the burden of disease might we see? And I won't go into all the details, but at the end of the presentation, I have put the link to all the papers that I'm referring to if anyone wants to understand any of this better. But in short, we found that so the base case we had was if there's no sanitation at all, you just got a toilet that's going straight to the drain. If you add a septic tank or an anaerobic baffled reactor, which is a similar technology, you could reduce by 72 to 100% if it was managed well, if it was emptied, if it didn't have cracks, etc. But if it was poorly managed, if you don't look after it, if you don't empty the fecal sludge, then you wouldn't have anywhere near as much of a reduction. And we also modeled other options, adding some extra treatment for the effluent, for the liquid coming out of the on-site system. And if you do this, you can reduce your risks much, much lower. So the implications of this, of water from on-site systems ending up in drains and surface water, is that it's an important exposure pathway, especially in dense living areas. It's one that we should be worried about, and we should be doing something about it. And if you added septic tanks into the same situation, it didn't necessarily have a lot of an impact, because the septic tank only removes about 1 log of pathogens. And if you start off with 7 log or 8 log of pathogens, you've still got a very, very high health risk with the water that's coming out. And so you need to have some kind of secondary treatment, either that's in the soil or you need to add some other technology. And one of the other implications of this study was that we found that there's really, really not enough evidence around pathogen reduction in different sanitation systems. And that's an area of research that we hope there will be more in the future. So we move to the second area. So that was about risks from on-site systems to the surface water. Here we look at the groundwater. And as Danny said, here in Indonesia, 37% of people are using this groundwater for drinking and other domestic purposes. And we know that if we have a sanitation system, for instance, such as shown on this diagram, there are many pathways for this to get to the well or a borehole and to contaminate that water source. And that is one of the reasons why we see the high contamination that Danny described. And so we have been doing a few pieces of research here in Indonesia on this topic. One was to see if using secondary data, we can try and understand which cities in Indonesia have highest risks, because then maybe we can focus our attention on the cities with highest risk. And so we developed a risk index, which is on the vertical axis of this picture, and it takes into account the type of water source people use, the population density, the kind of geology, because as I said, the treatment in the soil matrix is very important. So what kind of soil we have will influence how well the soil can treat the waste, and the type of sanitation. One of the pieces of data we needed to do even more accurate modeling would have been how deep is the groundwater, because clearly if it's deeper, then there's more protection and the less likely to get contamination. But all the cities that are in the top right-hand part of this graph are ones that had a very high risk index based on these different factors, and also where people are using, a large proportion of people are using groundwater for drinking. So we also did work in Metro and Bekasi looking at wells and bores, and here we can see what we found, which was that many of the sources, particularly the wells, were contaminated at quite high level. And I don't have it here, but we also compared the wet season, the dry season, and we found worse contamination in the wet season, where you get more mobilization of pathogens. We also did some work to try and understand the interactions between on-site sanitation systems and water systems. And so for an area of about 100 households, we collected a whole census of data of where every single on-site system was, where every single water supply was, and we looked at the contamination at 3 points in time, which is the graph you see here on the right, and we found that the contamination can vary quite a lot. So a source that is contaminated one day, maybe the next day it's okay, but then maybe the third day it's worse again. So there's a lot of variability. And we found that having livestock, this data is from Metro, so it's urban but also a little bit agricultural. We found having livestock was a very important factor, which I think speaks to what Danny mentioned before, that the whole hygienic situation around a house and around a water source have a big impact on the water quality. And we're continuing to analyze that data and try and understand things about, so we know that there's a regulation, a water source should be 10 meters from a sanitation system, and is that regulation sufficient? And we're finding that if there are two within 10 meters, definitely that it's a predictor that the water source will be contaminated. And lastly, we're doing work now, and this is still underway, so I don't have the details of the findings, but that previous study, it's very complicated to try and look together at both the water system and the sanitation system. There are so many factors that it becomes hard to associate one with the other. So here we're trying to do a different research design to simplify things. And in the diagram on the left, the rectangular box, that's a sanitation system. And then the dots are places where we've put in piezometers, which is just a tube going down to access the groundwater. And so we can take samples from those different places which are either closer or further from the sanitation system. And this is a much stronger research design to understand how far the pathogens travel. And we're also looking at how much, whether rainfall makes a difference, and also the level of the groundwater, because in metro the groundwater is quite shallow, and our hypothesis is if the groundwater level is higher, then the pathogens will also travel further. And so far we just have some early results which are showing what we expected, which is that the monitoring wells that are closer to the sanitation system, we are seeing higher levels of contamination. And at least at the beginning of the wet season, we also saw with rainfall and higher water levels that there was increased contamination. So the implications of this, looking at on-site systems and health risks in groundwater, are that chubluks and septic tanks are routinely contaminating groundwater here in Indonesia, also in many other countries. That if we have rainfall, it will cause the pathogens to move further. And if we look ahead to climate change and to having more intense rainfall events, etc., that may make the situation worse. And it means either we need to change our sanitation approach or we need to change the water supply approach. But we can't continue to have the combination of using, for instance, self-supply as well as using on-site sanitation. We're not able to keep a proper barrier between these two to look after people's health. So my last few slides, they're not complete, they're just a few examples of things maybe we can think about doing. You could have a whole presentation on the solutions, and I'll just give a few ideas. So firstly is about what we can do to think about changing people's water source, and I'll be touching on some of the issues Danny mentioned. Secondly, we can think about designing sanitation systems differently. And thirdly, if we do keep some of the same technologies, how can we have better information to protect people's public health? So first on changing water source. So as Danny mentioned, there's increasing use of packaged water in Indonesia. And this graph shows for different income level countries, it shows the level of piped connections, of piped water connections directly to households. And in that second bar of lower income countries, you can see Indonesia. It is very, very, very low. There's only 9 other countries that have lower piped water usage than Indonesia. And this is something that I think we all need to think about. Of course, the engineers need to think about it, but also people working in public health need to think about it, because actually we're going to need some very big behavior change work to be done if we want to think about shifting to use piped water to a greater extent. Even if we can't keep the piped water perfectly fresh so that we can drink it from the tap, at least we can protect it better than the groundwater sources that are becoming quite contaminated. And so one piece of work we have been doing, we've been using an approach called behavior-centered design that was from the London School of Tropical Medicine and Hygiene. And it focuses on the human motivations that are behind our behavior. Things like nurturing, things like fear, disgust. And we did some formative research in the west part of Jakarta to try and understand the reasons for people's water choices. And not just a surface reason, but really to understand underneath what are the human motivations that are making them make particular choices. And if we can understand them better, we can then design behavior change campaigns that actually touch those human motivations and might have more chance to change behavior. Because we know that just giving health messages, we know that that hasn't been so effective in changing behavior, and that we need to get to a deeper level of human motivation. So second one then, so that's trying to improve something about changing to a safer water source. But here, if we look about improving sanitation, a lot of work here is being done on shifting people from from a chubluk to a septic tank. And the Ministry of Public Works has big programs investing a lot of money to try and ask people to build a better septic tank that's built to design. But the issue is that we don't really have evidence for exactly how much health risk reduction that will give. Because as I mentioned before, the more important step of treatment is actually in the soil matrix. So you can change whatever you're containing your waste in first, but if you have high groundwater or you have other ways that liquid effluent is coming in contact with people, it may not actually be worth the big investment and the retrofitting that people are looking at. And this is an area we would really like to do more research so that we can inform policy about whether this is a good idea or whether it's not going to change the contamination so much. The other option you have is to build other types of wastewater treatment technologies, to add, as I mentioned from the Dakar study, that you can add constructed wetlands, that you can add secondary treatment after a septic tank to make sure that you're better treating the pathogens, or you can implement other types of wastewater systems. And as we address climate change and other issues, there's a lot more emphasis on how we can recycle in safe ways water in smaller cycles in cities, so that we're both removing the pathogens, but we're also providing a safe water source. And I think if we look to the future, I imagine here in Indonesia and many countries, there will be much, much more forms of water recycling. So another thing that we can do just to understand risks is do sanitary inspections. This is if you're using self-supply of wells and bores. We've analysed data from the use of sanitary inspections here in Indonesia, and we find that even though it's an imperfect tool for understanding contamination pathways, it still can predict whether household wells and bores will either have lower or higher contamination. So it's still a useful tool to help us in reducing risk. And one last tool to mention is called SaniPath. This is a way of looking at multiple different exposure pathways to a person. That may be through water, it may be through food, etc. They all relate to different forms of waterborne contamination. And if we understand the pathway through which a human is getting most exposed, then we can focus our attention to reduce the risk in that particular pathway. So, coming back to my 3 areas, I think we need to worry about the risks of on-site systems to surface water and also to groundwater, but there are some different steps we can take to address these risks, either to reduce the risks or change the way that we're providing either water or sanitation. Thank you.
Okay, thank you, Professor Julia, for the great presentations. For everyone who want to access the points or highlight that Professor Julia mentioned before, you can just see the links we'll give you, and you can read it, and maybe you can study it if you're interested in the today's topic. And Professor Juliet mentioned before that some solution might be possible. For example, solutions or options. It's like if you make way better in sanitary options, so it possibly will reduce the contaminations of water from fecal contaminations. And thank you, Professor Julia, for the presentations. Now we'll move to the third speaker. So before we start, I will read her short profile. So Dr. Vika Oktaria, MPH PhD, is a lecturer and researcher in Department of Biostatistics, Epidemiology and Population Health here in Universitas Gadjah Mada. Dr. Vika finished her bachelor and medical doctor in Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, and continue her master and PhD in Department of Pediatric, Faculty of Medicine, Dentistry and Health Science, the University of Melbourne, Australia. Dr. Vika also have several publications related to water and hygiene sanitations. One of which is Wastewater Monitoring Can Anchor Global Disease Surveillance System. It's published in Lancet Global Health. So Dr. Vika will share the presentation. So some of the points is relatively new, right, Dr. Vika, from the recent project. So yeah, without any further ado, I will hand over to you, Dr. Vika.
Thank you, Bu Anissa, and thank you for Prof. Yai, Pak Daniel, and also Prof. Julie for inviting me. And first, I would like to make a disclaimer that I'm not expert, not environmentalist, and I'm epidemiology with medical backgrounds. And this is actually things that me and my team are still learning about how to use wastewater as a surveillance. So here I'm talking about more on the dirty water. So if you think that river and open drain is something that it's troublesome from the health, but here we actually can see how the disease transmission is happening in the community. So I'm going to talk about the detections of using the wastewater surveillance and how its roles for the public health response. These are the 4 things that I'm going to talk. The concept of the wastewater-based epidemiology surveillance first, and then how we use this surveillance in the context of programs and also in the context and research, and also what about the future use of this wastewater surveillance. So the wastewater surveillance is actually not a new thing. Like back then in early 19, it was used mainly for typhoid and polio and also cholera. So to measure the disease transmission at the times. And due to the pandemic COVID, like it's becomes a new strategy that can be identified to help to monitor the disease transmissions in the community. And even after the pandemic COVID, we still we not yet finished. The COVID is still transmitting, but then people started thinking how to use wastewater surveillance for other pathogens such as typhoid, rotavirus, measles, and some other pathogens. And what is the concept? So it's basically when people got infected by SARS-CoV-2 or maybe typhoid, polio, the virus is replicated in their guts. So they then shed the virus through, although they are symptomatic or asymptomatic, all of them who are infected, they shed through the feces. And this feces will be go through this, the wastewater disposal and treatment system. And then the scientists or we from public health use that water collected from several locations, such as the wastewater treatment plants. But because like in Indonesia, we have only like low coverage of the centralized wastewater treatment plants, we expand to some locations, such as the public spaces. We collected from the septic tanks and also from the community wastewater treatment plants and some other like surface water bodies, including rivers. Then using the sample, then the samples brought to the laboratory, and we conducted several tests to make sure to test whether the pathogen is present or not, and also the titer of the pathogen, the concentrations. And hopefully in the future, after we know the positivity of the sample, then we can use this as a like instrument to help us to then perform public health actions, such as, for example, to do the risk mapping or maybe tracing infection locations, or maybe we can optimize the public health strategy. That's the idea of the wastewater surveillance. So if we classified into 3 different use of the wastewater surveillance, first we can use for early warning system, like we do with SARS-CoV-2 or polio. Like we will try identify if there in the future there is a new emerging maybe strains that is dangerous, like causing a severe disease, for example. We can also use for disease burden assessment. I think I heard before, like collecting the information about E. coli and other things. We did also in our study here for typhoids. So when it is hard to know from the surveillance, from the clinical surveillance, we may use this wastewater surveillance to help us to estimate the disease burden in the community. And the last one maybe can help for outbreak investigation. For example, if we know one cases and we can see how big is the the area affected by the disease transmission due to the outbreak itself. So first, using that like classification of use for the wastewater surveillance. So first, I would like to talk first about the wastewater surveillance in the context of program, which has been adapted by the national government. It's about polio. So if you hear like a couple months ago, I think in the early years of 2024, there was one cases reported of children with polio in Klaten, which is quite near from here. And polio is a disease that we aim to eradicate. So it is becoming a big issue whether or not we have to do response such as doing the immunizations, doing the outbreak response immunizations. So based on the result from the clinical surveillance, they also found detections in the wastewater treatment plant. So this is helping the government to then decide whether the cases itself, it is from Klaten or from the children's, because they went to the Sampang, which is in Madura, if I'm not mistaken. So whether the transmission itself happening also in Java, in here near Klaten. So this is the part that is currently doing by the Ministry of Health under the Directorate of Immunization. So because this is a part of the supporting the global polio eradication. So this is a complementary surveillance to the current acute flaccid paralysis surveillance, whereas that's a clinical surveillance. When we look at polio, it's have a high impact to cause the children have a floppy limbs and extremities, then which is and very highly contagious. So they want to make sure there is no wild poliovirus circulating in the community, and this is one of the strategy to help to capture, to monitor whether there is any additional wild type or maybe any what is called as the vaccine-derived poliovirus, which is the infection that is caused by the mutation of the virus as a part of the vaccine. So we know that the polio, we have the oral vaccine and the injection one. The oral vaccine itself, it provides better protection, but it has potential if then mutation happen, it could be, it can cause what is called as the vaccine-derived poliovirus. So it makes symptoms like a polio for the children. So it's quite dangerous one. So that's why they do these two surveillance, the wastewater and the clinical surveillance. Then currently there are 14 locations in Indonesia that perform this kind of surveillance, the wastewater surveillance. And from the result, I think most of them is the non-polio virus. So apart from those who have been, like found from the Klaten, but most of them is still reporting that's the most circulating strain is the non-polio enterovirus. And this is the wastewater surveillance in the context of research, which is mainly be doing by our teams and also some other team from BRIN. If we see, this is the timeline for wastewater surveillance in Indonesia. So we can see that the Ministry of Health doing the polio surveillance, and for the BRIN doing the antimicrobial resistance surveillance. And if you see here, up here, we were first contacted by the collaborator from Australia, from the University of Melbourne, to do the surveillance, the wastewater surveillance for SARS-CoV-2. At the time, it's during the Delta outbreak when the disease was quite severe. And then we that project actually it's just aimed to make sure that whether it is feasible to do the wastewater surveillance in Indonesia for SARS-CoV-2. Then after that, at the end of the year, at the end of 2021, we were doing another project to we want to evaluate whether this surveillance can be an early warning system for disease transmission, especially due to the COVID. And later in 2023, we do the cost-effective analysis. So we want to see whether what is the costing needed, what is the cost needed for doing the wastewater surveillance for SARS-CoV-2, and how cost-effective this kind of interventions. And while we're doing the SARS-CoV-2, we also obtain other grants to do the typhoid surveillance, the first, and then now we are running the second year of the surveillance. And then just recently, we were trying to expand more on how to institutionalize this wastewater surveillance into national routine surveillance. So this is, as I mentioned before, we did our first data collections in July 2021 during the Delta outbreak, and the second during the Omicron outbreak, which is in early 2022. So what we did, we selected the location based on the disease transmission, because during the COVID-19, like the local government and the local district office, they have like a website to put all the information about the infected cases, and then those were like fatal cases. So it's all information is available there. So based on that information, we then try to match with the environmental information where we can get a sample from the central wastewater treatment plant and some other location in the area with high disease transmissions. And different method we're using. We use the grab sample, we just grab the sample using certain bottles, and then also we use what is called as passive sampler. If you may see down there, that's the torpedo passive. So inside that instrument, there is a membranes and gauge where it can help to filter the water, and then we can then proceed the membrane into the laboratory to do the PCR. So that's the method that we use at the moment. And we include the river, the Jode River, the central wastewater treatment plant in Sewon, and some manholes in near Malioboro and other crowded locations. And this is the test is actually almost the same like what we did in human, what we do in human, but then we just need to do some pre-treatment. For the grab water, we have like around 500 to 1 liter of water. Then we need to filter it first using a membrane, and after that we need to extract the DNA, the RNA for the SARS-CoV-2. Then we can proceed for PCR to see whether it is positive or not, and how is the concentration of the virus. And then for the passive sample, we can just go to the extractions of the RNA or DNA, and then we go for PCR. So the PCR is depend on the target genes that we want to know. For SARS-CoV-2, we use the ORF and the N genes, while for Salmonella typhi, we have like T different gene that has to be positive, and then we validate with the HF183 to make sure that it is contamination from human, not other. So this is what we found. We try to link the information from our wastewater detection of SARS-CoV-2 with the clinical data. Here, the blue one is during the Delta, and the yellow one is during the Omicron. And we can see the red line here is the cases reported from the district health office. Then we can find here there is a good, like the cases is lined up with what we found from the wastewater. We collected for about 1,500 samples during that period. And when we try to map it, so during the Delta, when the case is very high, we can see the map is dark blue. It means the cases is very high. And if you may see, there are a lot of like red dots there showing the positivity of the finding at that times. And I think if you can remember at the end of the year, the cases was declined significantly. So if we can see here as well, the cases number, it's noted, the low cases is noted by the, like the light blue color. And we'll see a lot of green dots, meaning that there's not many positivity cases transmission in the wastewater through the wastewater detections. And when in January 2022, it started climbing up the cases from Omicron, and we can see that some of the part it's darkening, the blue color, it's also correlated with the positivity we found from our wastewater treatment plant. So it's pretty much aligned with what we found from the clinical cases situations. And we want to see whether this can predict disease transmissions in the community with 2 weeks lag. And if you see here, the red line is the cases reported by the district health office. And the blue and the green line is the what we found from the wastewater for different genes. And in week 24, we can find that 2 weeks prior to the increased cases in the community, we have found it is positive in the wastewater. But then when all the cases increase rapidly, so there is no, it's not quite meaningful anymore what we found from the wastewater. It is everyone, like everyone shedding, everyone infected, and they shed it through the wastewater. So that's pretty much explained that can be possible to be used as an early warning system. The next one, once we know that it is feasible and it is can be used as early warning system, we want to see the costs related to the environmental surveillance for SARS-CoV-2. And we did the CEA study. It's around March 2023. And this is to evaluate the potential cost effectiveness of wastewater surveillance for early detection of SARS-CoV-2 outbreaks in community. And based on this study, we found that like the average cost for per sampling is about 900,000 rupiah. So it's equal to maybe 60 USD, is it? If I'm not mistaken. So it's around that. So then this is mostly for the consumable, like buying reagents and other stuff, and the cost needed for equipment and human resource is much less than consumable. And this is in comparison, if we test everyone in the location, of course it will be like more expensive. So this is could be like a strategy to because we know that one sampling site could represent like the population that living in the region. So this could be a cost-effective approach for this identifying the disease transmission in the community. And then our teams, our college do the modeling for the cost effectiveness. If we see the A and B, the A is the scenario when the country or the location Indonesia have a proper COVID testing facility, while the B is when they have poor COVID testing facility. Scenario 1, if there is no wastewater surveillance, we only have the clinical surveillance running. And the scenario 2 is when we have the wastewater surveillance. Same here as well for the scenario 4, it's also when we have wastewater surveillance. And when we implement the wastewater surveillance and it is followed by timely public health actions, then we can reduce the death and the inpatient cost and ICU. It's quite it's between like 6 to 12 to 13%. And then it becomes more cost effective if we perform this in the location when the poor testing facility, or maybe even the people now, we know that after COVID has been going on, people are more reluctant to do the testing. So this could be like a good strategy to also identify the location or mapping risk within the populations. This is the other work. It's not SARS-CoV-2, but we also do the same things for typhoid. This was done because, for typhoid disease, it's a bit hard to know like how big is the burden, because most of people, they came to primary health care and they obtain antibiotics. So the gold standard is to do the blood culture, but then once they have received the antibiotics, so the positivity is usually be affected and the result came as negative. So it's hard to measure how big is the burden for typhoid in the populations. That's why the wastewater surveillance could be one of the strategy to measure the burdens, including those who are like the carrier of typhoid, and this can help to make then what other what is the possible public action for this, for example, like vaccination for typhoid. So we can make suggestions if we found that the prevalence is high. So maybe it could be suggestion to the public health or governments for the typhoid vaccination, for example. So the overall we found until today it's ranged from 42% to 10% to 42%, with the highest positivity is in the river. Maybe some of the people still practicing the open space defecation one. So it could be like the I don't know, maybe the source of the contaminations. So we can see here from the picture, those with darker blue is those who have like high positivity for for typhoid. Oops. This is the recent work that we do. It's about, then we move forward because we have tested for the typhoid and for SARS-CoV-2 and how we can institutionalize this wastewater surveillance. Although it is still a long journey, but then we first try to identify what are the pathogen of interest among surveillance and also immunization stakeholders, and then what are the stakeholders that should be involved, how is the legal aspect, and how is the feasibility to conduct this in wider scale, not based on the academic in the academic setting, but it's more as a part of the routine programs. And we did. This is part of the what we call as work package, where we have the work package. One is the identification of pathogen and stakeholder and make a framework for public health actions. The second one, we aim, if it is happening, we will do lab optimization for several pathogens. And 3 and 4, it's about implementing the wastewater surveillance in other regions and also calculate for the costing. And the 4th one is about bringing all the evidence and present it to the government to then whether they want to adopt this as a like routine surveillance system or not. So we did a kickoff meeting during quantitative survey, qualitative survey, and co-creations with important stakeholders such as Directorate of Surveillance, Immunizations, the Epidemiology Society, people from BRIN, and many others, environmentalists, and a lot of people. And from the information based on the meeting, these are the list of pathogens priority at the moment. It's from human pathogen aspect and from the One Health approach. Yeah. So this could be like a potential further use for wastewater surveillance. We just need to make sure that the method is now available to detect this in the wastewater. So we have polio, it's already in the system. Rotavirus, it has become important because we just roll out the routine vaccinations in the community. We can monitor the, like the strain, whether it is same or not with the current vaccine. And then measles, there are some outbreak potential diseases such as measles. SARS-CoV-2, it's according to the global consensus that maybe it is now, although the pandemic is over, but then it is still important to do routine monitoring to make sure there is no new strain that maybe could be a concern of public health. And yeah, this is some other potential expansions for this wastewater project. Could be like doing the cost effectiveness study and then zero survey that could complement what we found from the wastewater and other pathogen. And also what is one of the most important thing is also the AMR, because apparently the AMR is quite high based on the available studies. So this might be important for several stakeholders to then decide how to we can regulate the use of the antimicrobial drugs. Yeah. These are some pictures from our activities, including disseminations, conference, and also discussion, co-creation with the government. And the challenge at the moment is how to provide real-time result, because as a early warning system, we need to have like very timely result. This could be a challenge, especially due to the reagents availability. It's usually pending for like several months if we don't order in advance. And then the other thing is that the multi-sectoral coordination network, we need to really draw like the governance, how if we implement this wastewater surveillance, who are the stakeholder involved and how we orchestrate they all together to work, who responsible to which part, the sampling one or the interpretation of data, or on how to use to making policy based on the data. That's the thing that still a homework at the moment, but we need to sort of those kind of informations. And no clear budgeting at the moment is on still based on the like research, so it's morely from the international donors. So it's nil. If it is being adopted, then we need to make sure where the budget from, and lack of accurate data population catchment. Now this is the thing that we need to also know, like for example, one manhole, it represents of how many households. That's the thing that also needed, because we cannot like calculate using the data from wastewater. We cannot calculate how many number of people affected, because some people are super spreader, so they have more virus when they get infected, but some maybe not that much. So it's hard to then convert the data to the number of people being infected. So the conclusion is wastewater surveillance, it is feasible for polio, COVID, and typhoid for monitoring disease transmission, and can be used for other pathogen. It can roll as a early warning system, so it depends on the type of pathogen. So we can use as early warning for certain pathogens such as polio or maybe SARS-CoV-2, but for other pathogen like typhoid, we don't need prompt action, so that might not be suitable for the early warning system. And still need a lot of work for the multi-sectoral collaborations. That's the thing that we want to develop in the next couple of months and years, how to frame this collaboration between among sector. And it is cost effective based on our funding. And also the other homework is to make sure that there is a timely policy support following the result from the wastewater. So this is acknowledgement for everyone who involved in the study. Thank you again for the time. I return this to Bu Anissa. Thanks.
Okay, thank you very much, Dr. Vika, for the presentation. So, Dr. Vika highlight about the importance of surveillance, wastewater surveillance. One of them is to detect the early water detection, special to be specific in some disease. So, in the previous research, Dr. Vika also mentioned that the model or the research which is using wastewater surveillance is feasible to mapping or to detect polio, typhoid, COVID, and also monitoring the disease burden in Indonesia. Thank you so much, Dr. Vika. Please give a round of applause to all of the speakers. Thank you. Now it's if you have any questions, because it's a you can ask in Indonesia. If you have any questions, please do not hesitate to ask in Indonesia or English. But since you are MPS student, so we encourage you to English to give a question in English. But yeah, you of course you can answer give a questions bisa pertanyaannya dalam bahasa Indonesia, nggak apa-apa, nggak dihukum. So if you have any questions to Professor Julia, we'll help you to translate it to her, or maybe, yeah. Any questions so far? Oh yeah, one. I will first give it chance to her. Okay, so. Please mention your name.
Baik, terima kasih atas waktunya, Bu Anissa. Sebelumnya perkenalkan, saya Ragil dari Peminatan Kesehatan Lingkungan. Jadi gini Bu, Pak, I'm sorry Prof. Juliet, I will ask in bahasa. Jadi saya S1-nya itu udah kesehatan lingkungan dan saya lanjut ke kesehatan lingkungan juga. Nah, selama saya kuliah di kesehatan lingkungan ini, saya fokus kepada masalah sampah. Kan kesehatan dan lingkungan. Ternyata saya selama ini menghabiskan fokus saya ke lingkungan untuk permasalahan sampah. Nah, jadi dengan sependek ilmu yang saya punya, saya jadi bisa dibilang saya jadi anti dengan penggunaan botol minum sekali pakai. Jadi saya tuh berusaha untuk bawa tumbler dan saya di rumah juga pakai air isi ulang. Karena saya ngerasa saya tuh nggak mau menciptakan sampah. Nah, ternyata tadi Pak Daniel itu menjelaskan bahwa ternyata air isi ulang itu tidak sehygiene itu. Nah, saya jadi was-was sebenarnya sebagai calon ahli kesehatan lingkungan, mana sih yang lebih baik? Saya minum air Damiu, tapi itu menyakiti nggak tuh? Punya banyak bakteri di tubuh kita, atau kita nggak apa-apa minum air botol, tapi itu mencemari lingkungan. Jadi sebagai ahli kesehatan lingkungan, sebenarnya mana sih Bu, Pak yang lebih baik? Terima kasih.
Thank you, Mbak Ragil. So Mbak Ragil asked which options is good for her because she concerned about the microplastic if she use bottled water, and maybe she also concerned is it safe to consume the Damiu that you mentioned before. Dr. Daniel, you or maybe Prof. Julia, you have any comments or so please?
Okay, yeah. Difficult questions. I would say in my house we have not the Damiu, the unrefilled water, but the thing now we are thinking to the questions that we have actually now the main questions that I have is whether the treatment is correct or not, or whether the unsafe situations. So there's a big questions that we have to answer. That's why I think this is a big research gap that we have now. Whether the Damiu, but we found from the results that the Damiu is not safe. But when we talk about the unrefilled water, the water gallon from all these kind of brands, I would say that they are safe. But now the problem is the water storage, tempat mereka naruh itu loh, apa sih namanya itu? Dispenser, the water dispenser is safe or not, or is clean or not. There's a big question that I think this is a big knowledge gap that we have to answer. So I would say, trying to avoid this water bottle, so botol sekali pakai, trying to avoid this and using this unrefilled water, but bring your own tumbler to campus, for example. We have, I think there are some unrefill water dispenser in some locations, so you can take water from there using your own tumbler rather than using this the water that you take from the dummy or from water kiosk. I would prefer that thing. But I don't know whether you have answer.
And my only addition is that I think we ideally need to invest more in piped water and also improve piped water, and then we don't need refill and we don't need bottled water. And maybe we may still need some boiling practices, which in Indonesia are very good, because piped water won't immediately jump to being a drinking water standard. But to me, at least going on the path to improve pipe water in urban areas is really important. And the plastic waste that you're talking about is a huge issue. And then we hear about microplastics. We're just creating more environmental and human health problems rather than solving them.
Thank you, Dr. Daniel and Professor Juliet. So maybe we could improve the water pipe and also the treatment. So the pathogen will be reduced and it's easy and safe to consume. Thank you, Mbak Ragil, for the question. Any questions? Yeah, please. Please mention your name.
Okay, thank you. My name is Mahfira. I'm the MPH student from the concentration Health and Behavior Promotion. So I have question for Prof. Juliet. One of the strategy that one strategy suggests is to change the groundwater to the pipeline system, but I think there is another challenge to change the water source, groundwater source to the pipeline system. In Indonesia, the government provide pipeline system called PDAM, but sometimes we don't want to change to the pipeline system because of they cannot reach our areas, and if they can reach our areas, the pipeline system has inconsistent flow. So how can we overcome this another challenge from changing the groundwater source to the pipeline system? Thank you.
Yeah, it goes to you, Prof.
Yeah, very good question, and it's one that we have been talking about a lot in the research I mentioned about changing behavior, because the biggest barrier for people to want to join the pipe system is that the quality of the service is poor. And so yes, I think the starting point has to be more investment in PDAM from local governments, from national government, so they can improve their service. I think until we get a better piped water service, it's very hard to change behavior to shift to want to use that service. So I think maybe it's less a job for public health, but your part in it can maybe be around the pressure on the government to improve that service. To say from a public perspective, it's better for public health if we improve this service, and maybe we can put enough pressure to have the investment that we need to improve the piped water service.
Yeah, thank you, Prof. Juliet. So yeah, we need to improve the quality of our system, which is PDAM. So hopefully it could be better. Yeah. So the concern of getting a better water and good quality water, it could be possible for us. And we have questions from Zoom. Could you please? So yeah, one question from Safira Zamrudiani. Thank you for the presentation. My question is, how important is the integrations of water and sanitation approach in ensuring food security? And should there be a collaborative effort with the Ministry of Agriculture to address these issues effectively? So yeah, it goes to maybe Dr. Daniel. Food security. Okay.
I can start and you can add if you want. My thoughts are that we need both. We need collaboration across many sectors to work on issues like food security or public health, but we also need strong work in each sector. And so I think in what each of us talked about today, especially In terms of water and sanitation, definitely we need those two to be worked on together. It's not helpful to only work on water supply without understanding sanitation and wastewater, and vice versa. It's not helpful to only work on wastewater and sanitation without understanding water supply, because in the environment it's completely interconnected, and the way we think about each of them as services and ways to protect public health should be holistic. I think when it comes to food security, there are also many links to water and sanitation, because water resources are used for food, they're also used for daily basic needs, and there can be competition over the resource. And we know from wastewater, we have nutrients, we have aspects which can be used for agriculture to help food to grow. So definitely some cross-sectoral work is important, but I don't think we should only do cross-sectoral work. I think each area needs to have their own expertise and be addressing their own problems themselves, as well as working together. You want to add?
Maybe just want to add something. There's a big problem in Indonesia because all sectors, all ministry, they work themselves. I mean, they work separately, and there are meetings and there are workshops, and all ministry, all agency, they can sit together, but it is most often that people that join the meeting is not the one who can make a decisions. So just a staff. So basically there is no decisions, there's no really strong decisions and strong policy out of this kind of workshops. So there's a big problems, collaborations between multi-stakeholders in Indonesia.
Yeah, it's agree. Like what happened with the wastewater surveillance, it's like some of the part of the academicians and maybe government doing their own part, but they don't communicate to each other, especially for the One Health sector. They have like environmental surveillance for influenza, for example, but then like it's there is no like direct link to what we find from the, you know, like the human pathogens. So it is hard to, we can keep going. Yeah, the key is persistency. It's definitely the key, but like what Pa Daniel mentioned, that usually people who come is not the policymaker one, so that's a bit hard to make sure that that is being followed up. But if we can like what we do for this institutionalization of wastewater, maybe we will do like regular meeting to try to and ask them to invite them to co-creation meetings so they can feel own this kind of project. So making they own this kind of activities is usually can also help to engage them more. I think that's one of the things they want to.
Yeah, thank you. Yeah, we need a strong collaboration between all parties. So yeah, as Dr. Vika said, it's so we can own the project, own the regulations, and also yeah, we can strengthen all the collaborations of it, not only we as a researcher, but also the government. I will one questions from our participants through Zoom. I think I will choose that one. Eri Wijaya asked that, thank you for the interesting presentation on the recent study on water and health. The speaker provided the recent evidence about the health impacts of unsafe wash condition on children's health, including diarrhea. However, it always catch my attention that unsafe drinking water and poor sanitation might adversely affect pregnancy health. Is there any study done or currently ongoing in Universitas Gadjah Mada on this issue? Could you give us some insight? Maybe I will give it directly to Dr. Vika. Is there any information about the current studies, maybe, or maybe Dr. Daniel, please?
I'm not sure about whether there is an ongoing study, but I think the unsafe drinking water and poor sanitation have adverse effect to everyone, not only pregnant women. But the thing is that pregnant women if they have infection and something that may be like affected their children as well. So what kind of infection? It depends on the pathogen. Some of them may affect the can like induce abortion, if I'm not mistaken, if the mother have like, for example, urinary tract infections. For example, the diarrhea can, you know, like if she has diarrhea dehydration and other things. Maybe it's also relevant to the effect of the pregnancy outcome as well. So yeah, I'm not sure. I'm not aware for any study that directly link pregnancy with unsafe water. But I think the concern is that all unsafe water is concerning for everyone, not only the pregnant woman. Yeah.
One more question, is that possible? Yeah. Could you please show? No. Oh, you have questions? Okay, please.
Thank you for the chance, for the opportunity to ask. I'm Riancha. I'm from Promotion and Health Behavior. I would like to ask to Dr. Vika. The objectives of the wastewater surveillance is to providing an early warning system to the national system. But I would like to know, do you think our system is adequate enough to interface with the early warning system outcome itself? Since we learned from the pandemic also, we have tertinggal jauh dibandingkan dengan negara-negara lain yang sebenarnya juga sudah melakukan warning terhadap pandemi itu sendiri. And I would like to ask to the speakers, as Indonesia is LMIC, low middle income country, so actually based on the theory, which one first served by the government, the supply or the demand? I mean, should we interfere the population itself to raise the awareness of having the better quality system of the water, or should we more focus on building the adequate system to supply the water? Okay, I think that's it.
Thank you.
Thank you. That's a good question. I was in Sydney in 2020 during the pandemic for the whole year. So it was a bit different. Yeah, it was a bit different system. The way they use the surveillance at there, they have like, I think they combine the clinical surveillance and environmental surveillance. So they have a website, if I'm not mistaken, that mentioned that in this district, there is a, like positive COVID. So people who live there should be aware of that. There might be like some restriction and other to other district, for example, something like that. And also they have notifications for if someone who are like positive, for example, they went to the mall, and then there will be like notification that at that time in this store, people got infected, yeah, right? People got infected passing in this mall, in that kind of store. If any of you were around during that time, you should go to any hospital for testing. That's the ideal way to do this. But then if we back to the context of Indonesia, when some people, they have some of the population, they don't have like regular wages, so they rely on how they go out and then they earn their money for living. So it's a bit challenging. So this kind of again, back to the wastewater surveillance, it depends on the pathogen. But for COVID, for example, by maybe having selected locations, the risk mapping where the transmission is happening, we can be more localized the interventions. Maybe we not like shut down the whole province because we don't know what happens. And if we do test everyone, they might be reluctant and the cost is very high. But then we can sort of like having like the mapping where the transmissions is high. So maybe we can have a more stringent, like public health intervention in that locations. In Hong Kong, it's different. They even know, like, I think all of the locations are covered with the good centralized wastewater treatment, so they can locate the residential where the people have COVID. So it's really good, and within 24 hours, the result from the PCR return. So, for example, if you find a positive sample in one dormitory, then they will track down until they get the result. So they have like I don't know, they have like the algorithm to find out where is the source of infection, and then they do isolation and all the public health interventions in that location without affecting people that may be living further away from that source of infection. That's the ideal way. But then Indonesia, it's fragmented. We don't have like centralized, just only maybe 6% in Jogja, even in Jogja. So there's some modification, like, yeah, we may just able to monitoring the disease transmission, but I'm not sure if you can locate the exact locations for what happened in Hong Kong. But it still can be used for, like for typhoid, yeah, for we know the burden of disease. We cannot get the information from clinical surveillance or maybe the hospital surveillance, then we can use that to then consider whether we need to do some intervention for example, for vaccinations. So that can help to reduce the transmissions. That's maybe this for in our setting. We're still learning about that and find the best recipe to implement this. But yeah, hopefully we can have something that more tailored to our situation.
So maybe just on the question, should we start with the awareness raising or should we start with the supply of better water? I think for me, thinking about it, is the awareness is probably the most important part to start with, and it's for two reasons. So one is because there are so many behavioral things we can do to protect ourselves. Just even knowing whether the water is safe or not, we can have different practices. So I think that's one of the reasons why awareness is important. And the other is for the reason I gave earlier, is that when the public has a higher awareness of the need to invest to be able to have proper systems of providing water and sanitation services, when there's demand for that, then politicians and bureaucrats will need to invest in those systems. And I think here in Indonesia, we don't have enough pressure at a high enough level to have a good amount of investment in these very, very basic human services. And so raised awareness is needed for both those two reasons.
Yeah, thank you, Dr. Fika, for the explanation, and also Professor Julia. Yeah, we are still behind, but yeah, of course, there is still room for improvement. We hope that the what we saw today is inspiring you. Maybe if you have any interested with the topic, you can of course directly give questions or have questions to directly to our speaker. And yeah, I think that was the last. This is the end of the seminar. Thank you so much for coming to this room and also join us through the Zoom meeting. And we are happy that today's discussions is about the water conditions, recent conditions, recent project that the speaker give it to us. Semoga hari ini teman-teman mendapatkan insight yang sangat baik tentunya. Terima kasih atas partisipasi teman-teman. Bertemu lagi untuk topik-topik yang berbeda di seminar Rabuan berikutnya. Terima kasih. Sekian. Assalamualaikum warahmatullahi wabarakatuh. Give a round of applause to all of us. Thank you. Thank you.
Oke, baik. Terima kasih.
I'll give it back to you.
Oke. Terima kasih atas materi yang sangat luar biasa. Namun Bapak Ibu, sebelum kita lanjut ke acara selanjutnya, ada sedikit kenang-kenangan dari kami untuk Profesor Juliet. Mungkin Dr. Fika bisa diwakili untuk memberikan
souvenirs from. Okay. Thank you. Give an applause. Okay.
Baik, terima kasih sekali lagi. Boleh beri tepuk tangan yang sangat keras untuk para pemateri. Sekali lagi terima kasih untuk Profesor Juliet, Pak Denny, Dr. Fika, dan Bu Anissa yang sudah meluangkan waktunya pada acara seminar Rabuan kita kali ini. Dan kami ingatkan sekali lagi kepada seluruh peserta yang hadir secara daring untuk bisa mengisi presensi yang sudah kami bagikan di link di komentar, dan materi juga bisa diakses di link yang sudah kami bagikan di kolom komentar. Sekali lagi kami ucapkan terima kasih kepada seluruh pemateri, kemudian juga moderator, dan seluruh peserta yang telah antusias mengikuti acara seminar Rabuan hingga siang kali ini. Dan Bapak Ibu, demikian seluruh rangkaian acara seminar Rabuan kali ini. Mewakili penyelenggara, kami mohon maaf jika selama berjalannya acara ada hal-hal yang kurang berkenan. Dan saya Zilvani pamit undur diri, sehat selalu untuk kita dan berjumpa lagi di acara seminar Rabuan yang akan datang. Wassalamualaikum warahmatullahi wabarakatuh.